Hello, this is Andy Gates, and it's February the 20th, and we have some great news this month. Omicron massive drop across the US and Europe. Let's take a deep dive. On the good news, Omicron is dropping worldwide. The booster seems to be protecting against Omicron, but also that new BA2 variant has emerged. The vaccine decreased the viral load by 100x, so hopefully decrease the risk of you infecting other people if you are having a mild infections. Vaccine dropped the long COVID risk by 50%. That is really big news. I'll spend quite a bit of time today on some of the great information we just got about long COVID. And there's a new drug that's been approved by the FDA for IV treatment for Omicron. The bad news is, unfortunately, Omicron is driving a higher case hospitalization than Delta. And unfortunately, Pfizer had to delay their vaccine for less than 5 years old. We still live at limited drug treatment availability, so your best protection right now is still the booster. We have lots of breakthrough cases and infection in the US due to lower US booster rate. And the booster vaccine efficacy seems to decrease after 4 to 5 months, raising the discussion about a fourth dose. On the bad news and the ugly, US Omicron surge had a 63% higher mortality rate than Europe. We'll talk about why. The US has surpassed 1 million deaths in excess mortality. We're going to learn prior pandemic lessons after a viral infection and the long-term problem they had. And we have some amazing data on long COVID. You don't want to miss that, about some pictures showing how the virus is embedded into the tissue across the body. Quick disclosure there, I'm not getting a dime for this. I'm just doing this to try to help you digest scientific-based paper. I put all my sources on every slides, and I'm just trying to help you to make a better informed decision there. I'm not a doctor. So there has been a massive drop. You can see in both Europe and US the massive drop in the last several weeks. So fantastic news. It's dropping finally. Denmark, who has a big wave of that BA2, we'll talk about this, but has extremely high booster rate, decided to take away all the restrictions there and let the cases go through the population there because they have a lower hospitalization rate. France, the UK, and the US have a massive drop. So let's talk about Omicron. You can see in a period of 2 months it took over most of the world, but now we have that BA2 that's emerging. It doesn't seem to grow the same rate that the original Omicron was, so we'll keep an eye on that. And that BA2 is a mutation that is coming from the original Omicron. It has 30 mutations in common. It's starting to outcompete the original Omicron, which is now called BA1. And that was the big drive behind that Denmark surge we just saw there. It doesn't seem to be increasing hospitalization risk and severity, but we need a bit more data. And it looks like the booster shot is protecting against severe outcome. And it reduced the risk of a symptomatic infection by 60 to 70%. So it seems that the booster is effective against that BA2. So US, you can see a massive drop, 800,000 to 100,000 cases. Finally, we're seeing the drop in hospitalization, which always takes 2 to 3 weeks afterwards. And finally, a drop in mortality. We peaked at 2,500, which is still pretty high. And now we're at 2,200, dropping 13% in the last 2 weeks. One of the problems is that our positivity rate is still 7%. So ideally, we'd like to be below 2 to 3%. And so you still should assume that there's a lot of contagion outside. So one of the issue in the US is only 43% of the population is boosted. That means that 57% are at risk of an infection with Omicron. That, remember, Omicron is escaping 70% of your antibody. And that booster shot gives you a 60 to 80 times higher antibody load. And that's what you need. You need a full army to protect yourself against Omicron. There are 3 variants of Omicron. The one we have been talking for a long time is the BA1. There is a young brother or sister of it called the BA11529. And then this new one, this BA2, that pink one, that is starting to emerge in the US. Vaccination rate in the US is great for people over the age of 50. And we still have to work on the younger population. So here's the problem. The FDA had to delay the approval of the Pfizer vaccine for less than 5 years old. And it worked well for Delta, but it doesn't work well with Omicron. And one of the problems they had in their analysis, they didn't get enough infections there, so statistically they had a hard time showing effectiveness there. So the data show that it was helping the 6 months to 2 years old, and they had a good immune response, but not the 2 to 4 years old. And that dose was too low. It was not generating a good immune response. And one of the reasons is that the dose for the adult is around 30 microgram, and the dose for the that were being tested was much lower. It's 3 micrograms given twice. And what they're now doing is that following that same cohort and giving them a third dose and hoping that will provide that strong immune response, but we won't know the data until April. So why is that an issue there? You can see on this graphic there that Delta was pretty much leaving kids alone as far as severity and hospitalization, but now Omicron did not. And you can see there was a significantly higher rate of hospitalization for the kids, 5 times higher for kids under 5 and 4 times higher for kids under the age of 18 versus the Delta. So the vaccination rate, as you know, is lower. And so there's a combination unvaccinated and no vaccine available for the young kids. So good news for the adult population there is that across the world, the data showing that if you're boosted, you have a 99% reduction of a risk of fatality there. So it is the most effective drug I've ever seen in my history in healthcare there. So we're really blessed to have those vaccines available to us. Of interesting news showing that if you look at vaccine effectiveness against hospitalization, which is really the key thing we need to look for, because the vaccine won't stop the infection, but it will decrease your risk of a complex disease there that will lead to hospitalization. And you can see that if you have 2 doses and you have over the age of 25 years old, your protection was only 44% with the 2 dose. But if you get that booster shot, you get into the 88 to 90% zone. And so it's really important that people get that booster shot. The risk of a 70-year-old being in the ICU who is boosted is 0.25%. So during the Delta, if you're unvaccinated, it was 7%. It was pretty high. We know Omicron was not as severe, so that was a drop of 3x. And if you get the 2 doses, you had another drop there. And now if you get the booster there, you can see your risk is 0.25%. So I want to get a reality check, is that Omicron is milder, and if you're boosted, you have very high protection against hospitalization, ICU risk. Also good news is Lilly got a new monoclonal antibody approved called bebtelovimab. I'm not sure I'm saying this right. It is an IV base, so it's something that they're going to be keeping for people at extremely high risk of severe COVID for over other comorbidity. And it's not authorized for people hospitalized. So it's for people before they get in a hospital. Now, there's no dose available until the end of March, so it's still going to be hard to get. And that's one of the problems we have, is that we have some oral antiviral pills that have been approved. And the most important one is the Pfizer one, which decreases your risk by 90%, but it's still in extremely short supply. And right now it's being kept for immunocompromised or people who are at extremely high risk who are still unvaccinated. We have only 50% of the monoclonal antibody that are working against Omicron, but we have very limited supply, so it's really hard to get them. The Gilead or remdesivir is intravenous injection for 3 days in an outpatient setting, so it's not something that you can take if you think you're at risk there. So there's a treatment shortage right now, and the key is still to get yourself vaccinated and boosted. Other interesting news, this is based on the Delta wave that showed that Moderna was more effective at lowering the risk of hospitalization. And if you look at what's called the risk ratio, where they compare Moderna against Pfizer, you can see that you had a significantly lower risk of hospitalization if you had Moderna versus Pfizer there. Again, I want to emphasize this is on a Delta wave, but it was a massive data set. It was on 900,000 people with Moderna and 900,000 people with Pfizer there. And this came from the U.S. Veteran Administration system there, so a little bit older population. So other good news is the vaccine is decreasing the viral load drastically there, and that's really a big deal because remember, your highest risk of infecting other people in the first 3 days after you have been exposed, which is when the antigen testing are not reliable. Again, I mentioned that in the prior videos there. You cannot trust the antigen testing for 3 days after infection there. They can give you a false negative. But you can see that if you are vaccinated there, you had a massive amount of drop in the viral load. So that decreases the risk that you infect other loved ones around you there. So again, if you don't, if you predict the vaccine to protect also your risk of passing infection to people around you. So Omicron is unfortunately increasing reinfection risk by a factor of 2.4x. And so what they're showing is in New England Journal of Medicine is that more than 600,000 people in England have been reinfected with the virus. And I think we just heard the news that the Queen Elizabeth got infected and her son Charles, had been reinfected and may have accidentally passed it on to her. So again, if you were a survivor of a COVID Delta infections there, that doesn't mean you're protected against Omicron. So the booster may be losing its potency after 4 to 5 months, and that's a CDC statement that just came out last week. Now, I want to get a reality check on that, because that means that you still have your efficacy against hospitalization, which is what you really care about, that dropped from 91% to 78%. 78% is still extremely high. So you may get infected, but but you still have a pretty low risk of being hospitalized with severe complication there. This is a really large data sets coming from the US Vision Network with 93,000 hospitalizations that included Delta and Omicron. And you can see that the majority of people were unvaccinated or had 2 doses. So 4th dose, are we going to get it or not? The data from Israel is kind of mixed. What it shows is that it increased your antibody by 9 to 10x. So that's the good news. Remember, the booster was 60 to 80x, so it's not as much of a boost. And it's has a low efficacy in preventing mild or asymptomatic Omicron infection, as low as 11% for Moderna. Another way to say that is that you may still get infected, but you're being protected against a severe case there. But that means that you can pass on the infection around you. So Omicron is milder, but it's not necessarily mild. And in this graphic from the CDC, you can see the number of cases exploded. And although there was a smaller percentage in the hospital there, it still overloaded a lot of our hospitals, and then, of course, drove hospitalization and an uptick in mortality. And so hospital admission there were lower. It was 2.7% versus 7.8% for Delta. So that's the number that really showed that 1/3 lower risk there, but still 60 times higher risk for the unvaccinated there. ICU admission was 26% lower, with people having milder lung symptoms, so they did not need extra oxygen, not as much, and 74% had lower acute respiratory distress syndromes, which means it didn't need to be put on a ventilator. Hospital mortality was 12% lower, and that usually the multi-organ failure that started with the lungs and then to the kidney and to the heart. Length of stay was also lower, 5.5 days versus 7.5 days. So how will COVID end? Is this like the flu and then every year, we just deal with it? Or is it more like smoking? And The Atlantic had this really interesting article coming up this weekend that shows it's more of a tobacco argument. That's a behavioral choice. Unvaccinated adult is 68 times more likely to die from COVID than a boosted one. And smokers, this is a behavioral choice, are 15 to 30 times more likely to develop lung cancer. And so the question is that, how do we work this public health campaign? And as we all have learned, it's extremely difficult to change people's behavior. We spent the last 40 years on a lot of anti-smoking efforts, giving incentive and cash payment if you quit, as well trying to scare you with gruesome pictures and taxes and smoking bans. And we finally got from 50% to 14%, but that took a really long time. So the question is that, what do we do with COVID? We know that the efforts on behavioral changes for vaccine have not really worked. We have tried all these different things like we did for smoking. And so the discussions by public health officers is that, should we charge a higher medical insurance premium for people who refuse to be vaccinated, the same way we're doing it for smokers, where they pay a higher rate? Do we add it to the list of required vaccination for many more schools and workplace where you have to be vaccinated? So all of this, you're going to see more debate on that in the coming months. So what can we learn from the past? And what's very clear, that, and unfortunately we don't have a failure of collective memory, is that all these pandemic in the past that were due to a virus had long-term problems. In the case of 1918, they had what they call a long influenza. And they developed what's called encephalitis lethargica, which was a nice way to say it's an inflammation of the brain. And these people developed over time Parkinson-like diseases. we also learned after Ebola that in the outbreak in 2014, a lot of those patients had long-term problems with the heart, the brain, the eyes, and the joint, i.e. the virus is spreading in the body. We also learned from the post-polio syndromes that a lot of those patients over the decades developed relapse complication there, and then they had to develop mix and matching therapy for each person. There was no silver bullet. So why are we surprised that long COVID is a post-viral syndromes? And we've now already reported over 200 symptoms in 10 organ system damages there. And so I'm going to show you some amazing picture. So what is happening with SARS? SARS is neuropathogenic. It really has damage where it leaks into the tissues and creates neuroinflammations there, and then that kicks in the cytokine storm and damages the microglia cells. We also know it damaged the endothelial cells, which are the cells in the inner lining of your arteries and your veins. That creates leakage, that gets blood clots, which creates a whole bunch of problems like microbleed that can lead all the way to strokes. And we also know it damaged the neurons in your brains and in the rest of your body. So let's take a deeper dive and some of the data that's now coming out. So it increased cardiovascular risk of 20 different cardiovascular diseases after 1 year. This is a massive study from the VA where they look at 11,000 patients in the VA and 154,000 COVID patients there. The stroke risk increased by 52% and the heart failure by 72%. These are massive numbers. There's clear evidence of long-term heart and vascular damage in all age groups. And that's regardless of age or if you were smoking or non-smoking. As you can clearly see on the right side, if you had a severe case, which is the purple color there, you had significantly higher risk than you have if you were hospitalized or if you had a non-hospitalized case there. But let's take a look at some of the data there. Myocarditis, which is the one highlighting in red there, is your biggest risk. You can see the dramatic increase there. And this is like something that could be dormant. You may be fine. You're slowly coming back after a few months of recovering. And then you go back to your normal activity. And then you have these massive heart attacks due to an infection inside the heart. And so it's very important. Anybody who has any type of heart complaints needs to be checked there. So teens are vulnerable. 27% of teens in a very big study in Denmark on 24,000 positive teens developed long COVID there. And you can see they had a problem like trouble breathing and palpitations and cough and chest pain there. So do not assume your teens are invulnerable. So what's happening inside the body there? Data has been reported between 10 to 30% of people who are infected, regardless of severity, may develop long COVID. So this is not just people in the hospital. And people at high risk is people who had exposure to a high viral load. So if you went in an environment there where you spent several hours with somebody who had COVID there, in a poorly circulated inside room there, you have a significantly high viral load, which puts you at higher risk. If you have presence of what's called autoantibodies, which most people may not be aware of it, it also increases the risk of complications. And some people may have a dormant Epstein-Barr virus. This is a virus that's kind of a chronic fatigue virus there, and that could be reactivated by the viral infections there. And people with type 2 diabetes are at higher risk. So let's take a look there. We always assume, now we have the data to show that the virus is embedding himself inside your tissues for many months, and it continuously festers and create these chronic immune dysfunctions there, but this constant chronic infection. So if you look here in the brownish color, there is the coronavirus RNA. In blue are the body tissue, and you can see it's in the thyroid, the esophagus, the spleen, the appendix, the ovaries, the testicles, the adrenal gland. It's everywhere, and it continuously festers this inflammation problem. If we look at the gastrointestinal tissues, like the small intestine in this case, the virus is in green, and you can see it's persistent. And this was 92 days after the start of their symptoms there. So this holding 5 to 7 days flu symptoms and it's over is not true. This is a virus that stays inside your body and creates long-term damage. This is an 11-year-old girl who complained of abdominal pain. And 3 months following the diagnosis, she was diagnosed with chronic colonic inflammation. So they did an endoscopy and they took biopsies and tissue samples. And you can see in brown is the virus that's embedded. It has a nucleic acid and protein layers. It's an active virus. One of the characteristics of long COVID is people trying to exercise, and they have this massive setback after exercise, and they're kind of really exhausted for several days. And so it could be due to two kind of reasons. We know there is an impairment of the flow of oxygen, and because of the dysfunction of the heart. I mentioned the cardiomyopathy and some of these other problems there. We also know there's an elevated inflammatory substance called the cytokine that may injure the mitochondria. And of course, that's the furnace inside your cells that basically take the oxygen and transfer them into energy there. So if it doesn't function right, you don't have the energy. We also now are showing more and more what's called small fiber neuropathy. And you can see in the pictures below there in the light blue that you have damage to the nerve fibers there. And that leads to what's called dysautonomia. And dysautonomia is a malfunction of the autonomic nervous system. What that means is that if you're sitting and your heart rate and blood pressure are stable and you suddenly get up, normally your heart rate and blood pressure gets self-regulated and adjust based on the change of gravity. In this case, it does not, and people are having this massive swing in heart rate and blood pressure. So now we're finally seeing the pictures of that it's really happening as opposed to being a hypothesis. We also know about the brain fog, and the brain fog is showing a reduced attention in memory recall and word finding. And the very big concern is that this could lead to long-term neurological problems. And again, you can see on the left side is normal healthy tissues. On the right side is COVID patient with that brownish color there, that basically showing the mitochondria that is being activated by the virus. And unfortunately, we know that this overactivation of the microglia can link to neurodegenerative diseases. We also know there's also lower blood flow to the brain due to the circulatory problems there. So it's kind of a double whammy there. This is a picture that shows in green the SARS viral RNA, and you can see comparing the A to the B there that you have all this green everywhere. So it is embedded into your cerebellum. So how we protect yourself? I feel like a broken record. Vaccination seems to be the only protection we have right now. The data is showing that around 50% lower risk after you have been fully vaccinated. That came from multiple studies from the UK and Israel and the Veteran Administration. There are some mixed results showing in an Israeli study there recently that 19% of the breakthrough cases after vaccination still had a problem at 6 weeks, so there may still be a risk there. Right now, the only protection you have is vaccination. So 2-dose vaccination is dropping the long COVID risk. This is using the Delta infection there by over 50 to 60%. And so why is Japan did something right? What was the difference between us and Japan? In Japan, they had a very simple message. They called this the 3C, avoid the 3C, closed space, poor ventilation, crowded space, a lot of people, high viral load, and close contact settings, which is again all about managing the viral load. And it became a buzzword in 2020, and that led to a significantly lower mortality rate, infection rate. If you look about their cases, they got 146 per million death rate versus a literally 20 times higher number in the US. They also did retrospective contact tracings, and they quickly identified in March 2020, when the CDC was still thinking it was something that was on the surface, that it was all about aerosol in the air. And so they quickly educate people about avoiding closed indoor settings. Science was used to create a strategy and something that was very simple for people to understand, and there was trust between the public and the pandemic responders. And this came up with an interesting study that came from the Lancet that showed there's a correlation between the trust we have in our government and the interpersonal trust with people around us and the vaccination rate. And you can see in the US there's a lot of mistrust. There's a lot of mistrust with the US government and in that red bubble there. And so as a result of that, you can see that correlation between lower vaccination coverage and trust in the message being given by the government. And same thing in interpersonal trust. So the study came up that if we had the same level of trust that in Denmark, which is ranked in the 75th percentile, will have decreased by 40% the infection rate in the U.S. If we by 12% if we trust the government the same way, and 40% if we basically try to do the right thing for the people around us as opposed to just ourselves. So, interesting thoughts. U.S. vaccination has lagged behind. You can see on the left side the black curve that we were going up faster in the original 2021 access to the vaccine, but then we kind of leveled off, and the European and the rest of the world passed us in the vaccination rate. And more important, on the booster, we did a terrible job, honestly, in getting people boosted there, as opposed to Europe, who did a very, very short period of time. And what that means is that if you look in the dark blue, is that a booster rate, was significantly less on the right side there, around 40 to 50% than the rest of Europe, who did it really, really fast in a period of a month. And what does that mean is that the US had a 63% higher mortality rate with Omicron than Europe, because we didn't do a good job in getting a population boosted there. And so I reflect on this because that is a lot of unnecessary death for all the wrong reasons. So almost 50% of the US hospitalization could have been averted if they were at the European vaccination level there. Again, going back to having the trust that when the government says you should be boosted, we follow it. And as you know, we have a lot of dysfunction and distrust in this country right now. So if we compare the the death tolls, the flu of 1918 had 75 million people and had a 1% excess mortality rate at that time. We are between 12 to 22 million is being estimated of excess death with COVID-19, which is way above all the prior flu pandemic that we have seen in the past. Now, the difference is the age group. We have an older population that got, unfortunately, attacked by this virus there, as opposed to the flu in 1918, it was a younger population. It is estimated that death toll is 3 to 5 times higher than the official confirmed case. And that has come from The Economist and the Institute for Health Metrics and Evaluation. And Nature published an article showing it could be between 12 to 20 million excess deaths across the world. And that's by comparing the mortality historically versus the mortality now. And you can see that there's a wide spread there between the bottom curve, which is the official confirmed cases, and the upper bound. If you're interested in that, this is an interesting article showing that, especially in countries like Africa and India, there it's totally unreported. So in the US, it's estimated we've passed 1 million deaths of excess death. Some of the big states, of course, got hit pretty hard, like Texas, New York, Georgia, California, and Michigan. You can see had a pretty higher mortality rate versus historically over the last 5 years in all population there. It is estimated that 91% of these deaths were directly due to COVID, as opposed to be a contributing factor, but not the primary cause. I want to reemphasize that because in the press there was some confusion there. 91% of these excess deaths were due to COVID-related mortality. So please get boosted and stay safe. This is a new drawing. I just come up with a new series there. So I want to wish you the best. I also need your help. Please support these channels. Give it a thumbs up. Subscribe. Post to your network. I am trying to spread the word and help as many people as I can. I really appreciate you listening, and stay safe. Thank you very much.